I will turn it over to Dr. Krasner.
Welcome back, everybody. Anyways, when we started this echo focusing on COVID, it was the end of February. There were 50 cases in the US, 3 deaths, and it was promised that by Easter, the virus would be gone. So here we are about 10 months later, and we're setting records. We just passed 250,000 dead Americans, and the case rate's 160,000 every day. We're getting new records, almost 12 million infected Americans. And the people who have been predicting 250,000 deaths, by their models, they're predicting another 150 to 200,000 deaths by March. So approaching 500,000 dead Americans, which is unbelievable. And so, you know, just to review what's going on in Nevada, these are the first outbreak here. This is the summer peak we had, then the lockdown, and then the holidays came back. And yesterday, we had almost 2,000 cases reported, and actually this didn't include Elko had reported yet. So we're over 2,000 cases were reported yesterday in Nevada. If you remember, just at the beginning of September, we had 200 cases, and we're doing really great. So it's just an exponential growth, and that line is still going up very quickly. And the question is it because we're just testing more, or are we actually having cases? So if you go to the next slide, our positivity rate, so how many of every test, 100 tests done, how many are positive? Remember, when we were in the lockdown, we were down to about 4%, and then we had the outbreak and it came down, and now we're up to the highest level yet of 15.6%. So 15 out of every 100 tests are positive. So about 5% means you're picking up most cases, 15% we're missing a lot. So a lot of people estimate that in Nevada we have as many as 5,000 to 6,000 new cases of COVID a day, which is just fantastic number. And so the question, is that really causing us a problem, or are we just picking up, you know, college kids and stuff? So let's go to the next slide. This is hospitalizations. During the lockdown, we got down to about 250 cases, 300 cases. Then over the summer, we went to about 1,100. We were doing great again. In September, down to about 400. And now we're again on an exponential curve. We actually have more people hospitalized now than ever before. So these are not just 18-year-old college kids. These are people ending up in the hospital and sick. And so like here at the VA, we had initial outbreaks, and then fortunately we had a new ICU come online here, and we made it the COVID unit, and we actually closed it down for 2 months or so. At the end of the summer, there was not enough business. And now we're getting, we're full, and we're getting about 2 to 3 admissions a day, and keeping the place really busy. So we're seeing this whole lot of sick people, some dying, and really just overwhelming the healthcare system at this point, and certainly not even starting to taper off. And then we got Thanksgiving coming up, and we got kids coming back next week from college, Christmas. We have people staying inside, and so I would think we're certainly headed to a lot more cases. This is probably just the start of a massive outbreak, and the worst we've had all year. And so I work at Renown, and this was the physician's parking lot and visitor parking lot. And so in March, they got ramped up thinking they'd have a lot of patients, and they spent $11 million fixing this building up, insulating it. And then it turned out they didn't need it. So I said, oh, we spent all this money on there. But the COVID has come back so strong here in other hospitals that we've actually opened up the converted parking lot, and I think they had their first admissions this week. So this is a 700 to 1,400 bed overflow they need for COVID patients, and now they're starting to use it. So we're really seeing hospitals press to capacity, and in every hospital you go at, a lot of people are out with the infection, and really straining nurses and the physicians and other people take care of these patients. So it's not a pretty picture. Next slide. And so what do we, before we talk about masks, what do we got right now? We really don't have anything new. We have remdesivir in terms of treatment, very, very little evidence that does much for you. We have convalescent plasma, which may work if somebody's caught real early. And then we have dexamethasone, which reduces the death rate. So really the only thing effective right now we have is dexamethasone. We have some monoclonal antibodies coming out, but again, there's not going to be enough available, and you have to give it very early. And the country's not really set up to give outpatient infusions to patients newly diagnosed. And so really have nothing coming down the pipeline until we get the vaccines. We have two amazing candidates from Pfizer and Moderna. They do look great, but it's going to probably take 4 to 6 months to really get the general population hopefully signing on. So we have many months ahead of us of really black things going on. It's not going to be pretty. So what we have really, the only thing we really have right now to stop this are social distancing and mask. And so you still see a lot of people, you even see the senators saying, I don't wear a mask. And from the top on down, people are poo-pooing masks. So what do we have, when people say, I'm not going to wear a mask, what do we know about wearing masks? So I was going to use the rest of this talk just to talk about masks and their role, and how can they help reduce the community spread of COVID. So this week, the Centers for Disease Control really came out with a nice article summarizing what they feel the benefits of cloth masks are in the community where most people don't have surgical masks, and what are the benefits to the community, and what's the evidence that we have that masks actually make a difference. And they really come to 3 major conclusions. One, we know that it reduces the emission of virus-laden droplets. So basically the source control, the person who has the infection, whether they know it or not, definitely the amount of virus droplets coming out, exhaled into the environment, are significantly decreased. And this is very important, and people say, oh, I feel fine, why am I wearing a mask? But it turns out over half of transmissions come from people who are asymptomatic with their infection, or who have not developed symptoms yet of their infection. So one, we know it reduces the amount of virus-laden droplets, source control. The second is the question, is there a benefit to the person who wears the mask? Okay, we know that N95 masks, which are not in the community, not only prevent the expulsion of virus-laden droplets, but also protects the wearer. But what about the person who's just wearing a cloth mask? And what they find out is that the CDC now accepts that not only are you preventing the spread to other people of viral droplets, but actually works for the person wearing the mask. You can see up to 50% of the smallest micron aerosol droplets, not the big droplets, but the tiny ones that are aerosolized with the best cloth mask, can be absorbed by the wearer. So not only are you preventing the spread of virus-laden droplets to your community, but you're also reducing the amount of virus droplets which you're inhaling. So it's filtration for personal protection. You're protecting your community, but you're also protecting yourself. And they now accept the benefit of using masks to the wearer, not just to the community. And then one of the most interesting things that I came across was that the benefits to the mask-wearing individual actually increase as more and more people wear masks, if worn consistently and correctly. And so there's a little bit of mathematics coming up, but actually the more people wear a mask, the more benefit. The mask becomes actually more efficacious in preventing the spread of the virus. And so we're going to talk about all 3 of these things. But first, I want to talk about what are the best multi-layered non-valve cloth masks. What are their characteristics? And what they find out is that high thread counts with multiple layers, 3 to 5 layers of high thread counts in the cloth mask, are much more effective than single layer with lower thread counts. Secondly, polypropylene. Polypropylene can be incorporated into these cloth masks. That's the same material that's in N95 mask or surgical mask. It generates a form of static electricity that actually enhances the capture of charged particles. So a polypropylene layer, which you can buy and put it in as a filter into your cloth mask, or actually get a whole layer incorporated into the cloth mask, can be very effective in using static electricity and grabbing on those tiny charged particles. And then if you have silk on the outside, it may repel moist droplets and reduce fabric wetting. So the best multi-layered non-valve cloth mask, high thread counts, multiple layers, a polypropylene layer in between to get the static electricity benefits, and potentially silk on the outside. So these are the best characteristics, and we'll go over that again, but let's talk about what you don't want to wear. Next slide. What not to wear. Valve mask. Valve masks, they are regular, usually like an N95 mask, but they have a little unit that has a moving block. So when you inhale, the part of the disc moves up and blocks you from inhaling the outside air, and the air that you inhale comes through the filter itself, through the mask itself. But when you exhale, that disc moves out, allows you to expel your breathing, your air, into the environment where it gets exposed to everybody. So an N95 mask may be more comfortable for you, but what you do is basically sending out a whole stream of viral particles to somebody standing in front of you. I'm going to show you the next slide. So if you go to Amazon, you can find dozens and dozens of these for sale, these valve discs. And so the valve disc, you inhale it, it blocks it. Oh. So this is a video which gives you an idea what happens when somebody's standing in front of you with a valve disc. So you don't want to wear that. You certainly don't want to stand in front of somebody who's sending a jet stream of viral particles right to you. So these are totally unacceptable as masks. They should not be used, but I still see people wearing them. Next. So this is the other thing that we see quite often. Why don't you want to stand close to guys like this? What happens is that they wear their mask here, but the nose is not covered. And as you know, the nose, that's where you lose the sense of smell. That has the highest concentration of COVID virus anywhere. And so instead of breathing through your mouth, basically, again, when somebody's covering their nose, they're sending a jet stream of viral particles to you. It's almost the same as wearing a valve mask. So don't stand in front of these people. Don't stand near them, because if they got the infection, they're going to be sending you a stream of viruses right to infecting you. So wearing a mask like this, not covering your nose, is as bad as wearing a valve mask or not wearing a mask at all, because you're just spreading the disease and you're not fooling anybody with this. And obviously we see quite a lot of people doing this. So that's not acceptable. And the other worthless types of masks, we've talked about this a few months ago, but I'll show you. Fleece mask, which you pull up around your neck, and bandanas are very ineffective and may worsen the spread of the virus. And there's a big sign I just saw in Renown when I went there yesterday: fleece and bandana masks are not allowed in Renown Hospital. Okay, so let me show you the next slide then. So this was a study I talked about where these guys at Duke University, they developed a machine which the person would cough, and they would count over the next 30 seconds how many droplets when that person coughed that the machine could register. So, for example, this green is somebody who is not wearing a mask, and they averaged after about 35 minutes, they counted about 900 droplets of aerosolized particles. In contrast, down here, I'll go over this stuff, but basically these are patients wearing like fitted masks, surgical mask, you saw even after 35 days, there was almost no exposure of, after 35 seconds, there was almost no counting of any of these viral particles. So we see about 1,000 without a mask, and some of these here were extremely good. This 501 is, we'll show you in a second. So here they did the relative droplet count. So how many, if one was 1,000 up here, what percentage of the viral particles got through? And they basically have, you have a whole table here of going through the different types. So for example, a fitted N95 is 0, because if it's fitted properly, it's an N95 mask, it should block them all. Okay, so 0% were transmitted. A good surgical mask, almost as good. A polypropylene cotton mask, pretty good. A cotton, 5 cotton layers, but without the polypropylene in it, was about 0.1. A valved N95 is up to about 0.2. A cotton 1, so just a 1 layer of cotton, 20% transmission. 3 layers of cotton, about 25%. So we can see a cotton with a polypropylene filter in there was much more effective than 3 cotton by itself. But then we get up here, here's a bandana. It may look cool, but they had almost 50% of the amount of viruses were transmitted, viral particles, versus somebody who wasn't wearing a mask. And they went up to fleece, they actually got more than 1,000. So fleece was actually worse than not wearing a mask at all, than having no mask at all. And they were conceptualizing, they think that the fleece breaks the viral particles into smaller particles, and you actually increase the number of viral particles that are being expelled. Okay, so we can see that a fitted mask is fitted N95 is great, but you can do quite well with a polypropylene cotton combination. Much better than just using 1 or 3 cotton layers. It won't be very effective. But
Dr. Krasner, question here.
Yes.
Is there any information on reused mask effectiveness, an N95 or a surgical mask if they're reused?
I'm not an expert on that, but I think it has to do with the way that they are sterilized, may have some effect on it. But definitely a newer mask is the best, but I know there are different protocols, and I know that over time it does go down, but there is some efficacy for if they're done properly. But I can't really answer that question.
Okay, could you maybe talk about the sterilization protocols?
No, I'm saying I know there are different ones. I'm not sure what people are using. Some use their oven, some use gas. Maybe there's somebody else out there who knows more about what other hospitals are doing.
Okay. Yeah, does anybody want to share what you're doing for sterilization of masks?
He said, David said UV light.
Mm-hmm. Any other methods out there? Feel free to unmute yourselves or write in through the chat box.
Yeah, so this is Kara from Carson Valley Medical Center. We're using the Battelle system and sending them to the Battelle in Vegas they use the vaporous hydrogen peroxide method, and supposedly can be disinfected up to 20 times.
Yeah, Noretta Chan also says send for the hydrogen peroxide vapor. Thanks, Karen. Noretta.
So you mail it to them, or you send it down to Las Vegas and they return it to you? Wow.
Yeah, there's a process you have to go through of packaging and cleaning and whatnot, but basically, yeah, you ship it down to Battelle, they disinfect it, and it comes back to you as long as it meets their standards, which a lot of them get thrown out if they have makeup on them or whatnot. So makeup's a big thing. You can't wear makeup with that and go through the process.
Isn't it sort of crazy that after 9 months we still don't have enough masks for people? This doesn't make sense. Mm-hmm. Dr. Jensen asked me about the K95 mask, the KN, which is they're made in China, and I understand it's sort of a gray market, so you don't know what you're getting with those. Some are good and some are counterfeit. So they did not look at the KN95s.
And then Charlie, a question here about the different kinds of cotton. So is it really just kind of a standard like jersey cotton layer? Is that what these multiple layers are here?
Well, the article from the CDC recommended high thread count was being the most effective for it. So the higher the thread count in multiple layers, probably with the polypropylene filter in the middle seemed to be the best combination. And possibly silk on the outside just to catch water vapors.
Okay. Excellent. Great questions, everyone. Thanks for sending those in.
So we know that masks prevent the excretion. A good mask can prevent the spreading of viral particles. But how do we really know that it reduces infectivity to other people? Because there's always all these people say, "Oh, masks don't work." There's no reason to wear masks because they don't work. And so the CDC had about 10 different studies, some scientific, some just reports that seem to favor the use of masks. And this was just a episode that was very interesting, and we talked about 6 months ago. And these were two hairstylists, hairstylist A and hairstylist B. They worked at Great Clips, and they were friends with each other. And hairstylist A, they weren't wearing masks, and when they were at home and visiting, they were wearing masks. And hairstylist A infected her husband, a roommate, and their daughter, and also infected hairstylist B. So we knew that she was infectious, and she was actually symptomatic, but continued to work until she got her test results. And while she was symptomatic at the Great Clips salon, she was always wearing a cloth mask. And her clients what happened was there was 139 clients over an 8-day period that both she and hairstylist B, who subsequently became infected with symptoms, were exposed to. And 67 of these clients agreed to an interview and being tested. They all said that she was wearing a mask, because they all agreed on that. And the clients were required to wear a cloth mask or a surgical mask. So half of them wore either one of those. And of the 67 clients that agreed to be testing, every single one of them was negative. She spent an average, both of them spent an average of about 15 minutes getting their haircuts. And so she was obviously contagious. She infected the other hairdresser B. She infected her family when she wasn't wearing a mask. But at work, when she's right next to somebody's head wearing a mask, and the client was wearing a mask, as far as they know, not a single client became infected. So that was, just a good evidence that wearing masks work, even in a close-up. They weren't social distancing, obviously, since they were giving each other haircuts. So that was a very interesting study. Next one.
Dr. Krasner, do you recall what state this was in?
No.
Okay.
There's Great Clips everywhere. So this is, if you remember back in the early part of the epidemic, some of the cruise ships became infected, and there was this very large battleship called the USS Theodore Roosevelt that had thousands of sailors on it, living in very tight quarters. They'd be packed on top of each other. And a lot of them got infected. I think even one died, if I remember correctly. And so they did a study. They got 380 of these sailors, and they studied them to see how many developed neutralizing antibodies after this being on the ship, and what the risk factors were for becoming infected. And on the ship, they were not required to wear a mask. And they found out that those sailors who reported not wearing a mask, they had an 81% infection rate by development of neutralizing antibodies, versus those who self-reported wearing a mask, 55% developed infection. So they went from 81 to 55% infection. which again was a 70% reduction in infection rate with mask wearing. So again, and this is a living laboratory, these people are on top of each other, they can't go anywhere. It definitely seemed to significantly reduce the incidence of transmission between the sailors. There was a number of other studies on the CDC article that looked at China and in Thailand and other studies. Again, very supportive of the fact that wearing a mask seemed to reduce the risk of becoming infected. Next. So this was very interesting. So what happens is that, you know, if you think somebody, two people are wearing a mask, and it's quote 50% effective mask. So you can, a person wearing that mask, his risk of infecting other people is 50% less than if he didn't wear a mask. So most of the virus was screened out. But if two people are wearing a mask, there's actually not a 50%, but a 75% drop in transmission risk. So for example, this is from this video. So here's a person not wearing a mask. He has whatever the risk of a 0% drop in transmission because he's not wearing a mask, okay? So whatever the rate is, good chance of getting infected. If this person is now wearing a mask, that's 50% effective in blocking viral transmission. This person here, since the viral amount of viruses would be half as much as somebody up here, would be a 50% drop in transmission. So a 50% lower risk than this person of developing infection. If this person here is wearing a mask, this person here is not wearing a mask, so this is a person who's spreading the disease. But this person's mask, again, results in 50% screening, filtering out of the virus. So again, whether or not he's transmitting the virus or accepting the virus, these people have a 50% drop in transmission rate. So this person, 50% less likely. This person, 50% less likely too. But if this person is wearing a mask who has the disease, and this person is wearing a mask who does not have the disease, you have 50% of the virus going to this person's mask. But now the mask is filtering half this. So this person has a 75% drop in risk of infection. So if this person's wearing a mask, not wearing a mask, 50%. But if they're both wearing a mask, there's a 75% drop in transmission. So even though the two masks are only 50% effective, this person's cutting the viral load 50%, it's going down 50%. So you can get a 75% drop in transmission. And so the more people that are wearing a mask in a group, you get more increasing numbers, decreased risk. So if you're wearing a 50% effective mask, you have a whole group of people. Instead of a 50% drop in transmission, you may have a 70 or 80% drop in transmission. So taking that into account, right now, Scott Friedan was talking yesterday. He says the RO, which is the number, if somebody has COVID, how many patients are they going to go infect where we stand right now in this country? So if you have an infection, the average person infected is now infecting 1.4 people. So that is why, as long as things continue what we're doing now, this epidemic is just going to continue getting worse, because for every one person infected, they're infecting about 1.5 new people. But if 60% of the people wore a mask, that was 60% effective. It would reduce infections by 60%. If everybody was wearing a mask and they're 60% effective, you'd probably have a 90 to 100% reduction in infection. But if only 60% of the people wear a mask that's 60% effective, it would be a 60% reduction in infection, not 36%, because you actually, the benefit of two people wearing a mask is more than the benefit of the mask itself. And if we could do this, the infection rate would drop below 1 and we could control this outbreaks. So what's basically, if people wore a mask that was only 50% effective and most people wore the mask, this is the only thing we have to offer people right now. We have 3 months of an epidemic going on, which we have no interventions to prevent. And we're not going to have a vaccine for, widely distributed for 4 to 6 months. So this is all we can do, social distancing and wearing masks. And it not only helps you, but it helps the other people. And we saw this previously when, we had mask wearing over the summer and earlier. We can control this virus, but right now, unless people wear a mask, and it doesn't have to be a great mask, it's just 50% effective. If the majority of people wore a mask and they wore it properly without a valve mask, without a nose covering, we could control this virus really well. And so it's a very bleak future unless we do something about this. And so I just thought this was interesting. This is actually a nice videotape that goes through all the mathematics of it, how effective it is. The one thing interesting about they were talking about, it says this is assuming everybody wears a mask. But what happens is that they may find out the people that wear masks may cohort together versus those who don't wear a mask cohort together. So the people that are wearing a mask are protecting each other, and then people aren't wearing a mask are not that from this mathematics. Anyways, I'm no mathematician, but it's very interesting that if you have 2 people wearing a mask, it's not a 50% reduction, but it's actually a 75% reduction. So all I can say is that we really need to encourage people to wear masks, wear them properly, and this is all we have to offer at this point.
Okay. I want to get to some comments and questions that have come in through the chat box. So Dr. Van Gilder just shared that in order to get further N95 masks from DEM allotments, they have to use the Battelle sterilization program.
Okay.
And then Dr. Warko has a question regarding mask wearing and CDC quarantine recommendations. So Dr. Warko, if you want to unmute yourself.
Yeah, hey, Dr. Krasner. I'm just curious with that information, because as far as I know, and I think the local epidemiologists that are doing the contact tracing in Northern Nevada here, that exposure or potential exposure where it's 15 minutes, inside, they don't take into account at all whether either the patient who is suspected or tested positive, as well as all the potential exposures, doesn't take into account whether they were wearing masks or not. Should we be modifying the quarantine recommendations if it was, everyone was in appropriate masks, or should we still be recommending 14 days no matter what?
Yeah, they changed it from 15 minutes at a time to 15 minutes throughout the day. And I never really understood that because it was based on like 1 or 2 people. They had someone in a prison that was wearing a mask and other people weren't wearing a mask. So it's not really clear but I think knowing that 2 people are wearing a mask, I don't see how you can call that as high risk as only 1 person wearing a mask. I mean, I think the risks are significantly lower, but those have been sort of, what you're saying makes a lot of sense, but those are just sort of the guidelines that have come up with it. But I think, around here in the hospital, we're all wearing masks, and I think the risk of an exposure is certainly different if somebody's not wearing a mask. But, we're sitting in these patient rooms with a patient and the door closed. So that gets me scared. But I think what you're saying makes good sense, but it is still their guidelines.
Thank you.
Thanks for your question, Dr. Warko. And then Kara asks about, we talk a lot about masks, but in the healthcare world, we have to wear eye protection also. Where does that play in with the community when we don't have eye protection in place generally?
I know in the hospital, it's certainly important, when you're doing a high-risk procedure like a bronchoscopy or things like that. But I don't think the guidelines are at this point that we need to wear eye protection in the community. I'm not convinced that we see so much transmission through the eyes. I just don't see the data for that. I think just getting people to wear a mask is more important. And biggest problem wearing a mask is you get your glasses fog up, especially in this cold weather. It's like crazy. You can get hit by a car walking across the street because you can't see what's going on. Well, I can't really answer that, but a lot of people do wear a mask. Wear goggles. Certainly, if you're around patients that have it, it's very important, but I'm not sure it makes a difference in the community.
Noretta asks, and then on to you, Norm. Noretta asks, can we rely on antigen results when cohorting positive COVID residents, or should we wait for PCR results to confirm the positive antigen result?
I think the antigen test probably is more beneficial in the patient is symptomatic. I know that negative tests, they are referring them over in a symptomatic patient for a PCR test. So I think it's helpful if it's positive, but it's certainly not rule out a disease in somebody who still has symptoms. I think those patients should be referred for PCR testing.
Alrighty, thanks for your questions, everyone.